The Texas legislature will vote on hundreds of bills each session. Often those debates can get overlooked, even on critical legislation. That's why we've asked legislators to come to TPPF to talk about their bills to make sure you stay on top of the most important issues making their way through the Capitol. This is The Layout. I'm David Balat, and today we're discussing HB 1973 with Representative Caroline Harris. Welcome to the show.
Thanks for having me.
Tell us about what sparked this bill and the problem that you're trying to solve.
Absolutely. What sparked this bill is making sure that consumers have more transparency with healthcare when it comes to your medical billing specifically. And in my district, in House District 52, I have constituents who are being sued over medical bills as low as $1,000. And they're not able to get an itemized receipt for those medical bills. And so HB 1973 states that before you pay a medical bill, after you've received all of your services, before you pay that bill, you have to be given an itemized receipt. And we receive an itemized receipt in almost every other area of our life, whether it's a grocery store or going and getting your car worked on. And so this is a very big piece of your life, a medical bill that you should receive an itemized receipt for. And so that's what the bill does.
How would the lives of Texans be changed by this?
That's a great question. And so I'll walk through practically what this looks like. So you go to the hospital or your doctor or you go to a clinic, you receive the care. A lot of times this is the care that you need in order to be healthy or recover, right? And then after that care, when they send you the bill, they will give you an itemized statement that says, okay, this is how much insurance covered, and this is how much you owe, and here is every single service we provided to you. So you'll even have the billing code, you'll have a description, and then you'll have the cost of that right next to that. And this is so helpful because if you're looking at that receipt and you realize, now wait a second, this says that they gave me an IV, but they didn't, for example, you can then call them back and say, hey, according to my itemized receipt, it says I received this, but I really didn't. Can we talk about this? And so it gives you a chance to make sure that that bill is accurate. And right now, under current statute, you have to know that you can request an itemized receipt, and they can take a long time to get it to you. Not only that, it really doesn't have a lot of description on there. It has the billing code, it has the price, but that's about it.
Well, the other two elements of the bill that I love are you require the plain language description, which oftentimes there's nothing plain about the language in an itemized bill. And then the third element, which most people have not really spent much time talking about, is that if that itemized bill is not provided to the patient, then the hospital or the provider is prohibited from sending them to any kind of collection effort.
Absolutely. And that goes back to my constituents. I have one small claims court that told me that 70% of their cases from 2019 to 2020 were medical billing cases. And these are not people who can afford to pay large medical bills, but we're not really talking about large medical bills. We're talking about bills like a $1,200 bill that a single mother received who has two children, working two jobs, who, because she was afraid to go to court and didn't want to spend money on an attorney, she just paid the bill outright from her savings without having, because she was afraid of going through the court process, but she never got an itemized bill. So she had never had a chance to even go through and make sure that that bill was accurate and that she was paying for something she really was supposed to.
And I can tell you that oftentimes those itemized bills, if you get the chance to look at them, there's a lot of mistakes and things that could be corrected, things that probably weren't provided. Not that they were being intentionally devious.
Absolutely.
Mistakes happen.
Yes.
But it gives the consumer, the patient, the opportunity to identify them and have them removed.
Yes.
Now, I want to talk about, this was heard, and I believe it's been passed out of committee.
Not yet, but the hope is this week. So we're
Okay.
working on a committee substitute. So
Well, one thing that I heard that was fascinating was
Yeah.
some of the detractors of the bill
Yes.
said that people really don't care about the prices or the services. They only care about what their benefits are.
absolutely.
What do you say to that?
You know, that is probably the biggest problem I have with people who do not like this bill is talking about how consumers don't want this. And this is an argument that is just false on its head. If you or I put a Facebook survey up on either one of our personal Facebook pages and said, would you like to receive an itemized receipt before you have to pay a medical bill? The answer would overwhelmingly be yes. This is a pretty straightforward deal, and yet they keep telling me that their consumers are only concerned about the number that they have to pay. And when we know that there are medical errors, I mean, the most recent data suggests that 80% of medical bills have errors, right? And so for them to say that we're just going to give you a number and that's all you care about and you don't want to double check anything, that's, to me, dishonest. I really don't think that's true. And I think it's a pretty straightforward approach.
Well, you hit on an important piece of information. Earlier, you said your constituents are dealing with bills that are anywhere from a few $100s to a few $1,000s. Today, deductibles are $5,000, $6,000, sometimes $12,000.
Yeah.
Not to mention beyond that, there are coinsurance amounts that lead up to an out-of-pocket
Right.
maximum. The amount of money that the patient has to put forward to medical bills is significant,
Absolutely.
which makes us essentially cash patients.
Oh, yeah.
And so until that cash requirement is met, and before insurance really comes in to really help, of course people are going to care about how much
Right.
they're paying. Of course that it means something to them. The benefits don't mean that we're immune to
Right.
what things cost or whether services were actually provided to us.
That's true. And I think that the other part of the bill goes back to changing our perception of healthcare as a consumer, right? I mean, we have power as a consumer, but when it comes to healthcare, we don't really think in those terms. I think so often we think in terms of, well, we just have to pay this, right? This is just we're given the bill, we just have to pay it and move on, right? And, other data says that 6 out of 10 Americans have medical debt. And so, we need to start to question, okay, now wait a second. Why are prices so high? And is this completely accurate? Because this is impacting so many Americans on a daily basis. Medical care is something you're always going to need. It's always going to be a part of your life, but it doesn't have to be in the form of medical debt. And that's another piece of this that I really like to discuss because I want to make sure that everyone knows this would impact every Texan at some point in their life. And we're all going to end up in a doctor's office or at the hospital or something like that, paying a medical bill. And so we want to make sure that consumers have as many tools at their fingertips to keep them out of debt, but also to make sure that their care was accurate and they have the ability to fight that if they need to.
I can tell you've been working hard on this bill. There are a number of authors, lots of co-authors, I think in total over 102.
Absolutely.
So this is important to representatives and their constituents. I want to thank you for bringing this session. Transparency is important, especially something that is badly needed to transform an industry that isn't necessarily focused on the patients.
That's very true. And the last thing I'll add is, when I was campaigning, I just got elected in November. When I was campaigning, I knocked on almost 11,000 doors. And this came up so much more than I thought. This was a discussion that, regardless of party line, everyone had a story to tell me of how this bill could impact their life in a positive way. And so this is something that is really near and dear to my heart. I know it will impact my constituents, but I also know it will help all of Texas.
Well, thank you for being here.
Thanks for having me.
Yeah.